Well, we were talking yesterday, several public health units in southwestern Ontario say they've been seeing a spike in cases of whooping cough. And on this edition of Wellness Wednesday this morning, we want to take a closer look at signs, symptoms, and how parents can stay on top of this. Joining us for this live via FaceTime is Dr. Dina Kulik, pediatrician and founder of the Kid Crew Clinic. Dr. Kulik, good to talk to you this morning because this came as a bit of a surprise to many of us. Any idea what's behind in this surge of cases in southern Ontario?
Good morning. Unfortunately, throughout the pandemic and sometimes other times as well, people don't stay up to date with their vaccines. And a lot of adults in particular haven't seen their doctors for quite a few years. Kids as well may have been a bit missed during the pandemic. And when we don't stay up to date with the pertussis vaccine, the whooping cough vaccine, we can fall prey to getting an infection like this.
So it's likely being behind in vaccinations. Dr. Kulik, you mentioned adults and children there as well. Is there one sector of the population that's particularly most at risk? Because we've heard a lot about cases in children in particular.
For sure. So we start to vaccinate babies when they're 2 months of age, and then again at 4 months and 6 months, and then into childhood as well. What ends up happening most of the time is that adults are under-vaccinated, or they have had vaccines when they were children, but they have not been up to date with the vaccines. We're meant to get this vaccine every 10 years as we get older. So little babies could be at risk having not received one or any vaccine yet, and adults may get pertussis, not even know it. They might just have a minor cough and cold illness. And if a young baby gets it, particularly a little one less than 2 months of age, they are at high risk of getting very sick with it.
Okay, that's interesting. So it's interesting because this is something I think a lot of people kind of didn't even realize was kind of still around here. But these symptoms, I understand, manifest a bit like a cold. How do you know, though, if you've got whooping cough, or do I have to basically come and see you?
You would need to be swabbed. That's right. So most adults and young children truly with whooping cough or pertussis will have mild symptoms like any other virus they might get: runny nose, cough, fever. However, if that individual hasn't had recent pertussis vaccines, or it's been more than 10 years since their last one, or they're high risk, absolutely they should see their healthcare provider. A young baby for sure should go to the emergency room if they're having difficulty breathing, and we can do a swab to check if they actually have this bacterial infection.
All right, and obviously that would be a key situation if your child has got those symptoms you're just describing there. You talked about vaccines already, Dr. Kulik. Any other kind of preventative measures we can take?
Staying away from sick people as much as you can. Usually these illnesses are passed through families, though, with an older sibling or an adult caregiver that has this illness without even recognizing it because it's not so serious for them, and young babies in the home. Certainly, as much as we can stay away from people that are sick, it's very important, particularly now, having gone through the pandemic, many people haven't stayed up to date with their vaccines or routine visits with their healthcare provider, kids and adults. I definitely recommend people follow up with their healthcare provider and do a review. Where are you at with vaccines? What may you need? What might you be behind on?
And Dr. Kulik, if someone does come to your office or any doctor's office and finds out that, yes, in fact, you do have whooping cough or your child does, what does the treatment look like? How do you deal with it?
It's antibiotic treatment, very well tolerated, pretty easy to give and easy to find. However, people can be contagious with whooping cough for 3 or even longer weeks. And so we do definitely want to isolate that person to make sure that they're not potentially spreading it to their friends and family.
Okay, Dr. Kulik, really important conversation. Thanks for joining us here on this segment of Wellness Wednesdays this morning. I'm sure we'll talk soon. Take care.
You too.